Okay, good day everyone. So for this recorded lecture, we're going to discuss your diverticular disorder. So we have actually two, no? We have your diverticulosis and we also have your diverticulitis. Okay, pag sinabi nating diverticulosis class, that is just the outpouching of your intestinal mucosa. Ibig sabihin, nagkakaroon ng sac-like herniation, no, dun sa lining ng ating bowel that extends through a defect in our muscle layer. So, ang nangyayari pag sinabi natin diverticulosis, for example, this is your large intestines. Okay, this is your large intestines. Nagkakaroon po ng sac-like herniation, ibig sabihin, nagkakaroon ng mismong displacement dun sa mismong natin, sa mismong lining ng GI tract natin. Like for example, nagkakaroon siya ng pouch, ganyan. Okay, this is your diverticulosis na tinatawag, nagkakaroon ng outpouching of your intestinal mucosa. And usually your diverticulosis class, they usually occur anywhere in your GI tract. But then, ang pinaka-common site po kasi ng ating diverticulosis is your sigmoid colon natin. Okay, your sigmoid colon is the most common site of your diverticulosis na tinatawag natin. And usually, okay, yung diverticulosis natin or diverticula, they tend to be asymptomatic. Ibig sabihin po, you cannot detect or you cannot determine if you have outpouch in your intestinal mucosa if you're not going to undergo diagnostic tests. Okay, so they tend to be asymptomatic. Wala po silang any symptoms na pwede mong maramdaman kapag meron kang diverticulosis. And usually, bakit po tayo nagkakaroon ng diverticulosis class? Ang pinaka number one cause, okay, kung bakit tayo nagkakaroon ng diverticulosis class is your constipation. Okay, your chronic constipation. Ngayon, di ba pag constipated tayo, ano pang nangyayari sa tae natin? Nagkakaroon po tayo ng tubol. Okay, yung tubol, ibig sabihin nun is sobrang tigas po ng tae natin. What are the usual cause kung bakit tayo nagkakaroon ng tubol? Sabi natin, number one, we have your chronic constipation. Okay, meron kang chronic constipation. And aside from that one, na meron kang tinatawag na low fiber intake. Okay, pagdating sa diet mo, mababa ang fiber natin. Ibig sabihin, hindi ka naggugulay, hindi ka nagpuputas or whatsoever. Okay, or any food that are rich in fiber. And aside from that one, mababa din ang iyong or decrease ang iyong oral fluid intake natin. And then last, we have here your sedentary lifestyle. Okay, so how could we correlate your sedentary lifestyle with the formation of your tubol? Of course, if you do not engage to any physical activities like exercise, of course, wala ka ding decrease din po or slow din po yung ating intestinal motility. Okay, so these are the reason kung bakit tayo nagkakaroon ng tubol. Ngayon, pag nagkaroon tayo ng tubol class, ang mangyayari dyan, nagkakaroon po ng increase in your pressure. Anong pressure po yan, sir? Saang pressure po yan? Nagkakaroon ng pressure at your tinatawag na intraluminal pressure natin. Intraluminal, or ibig sabihin ng intraluminal, that is just the mucosal, no? Or the submucosal layer of your muscular wall in your GI lining natin. Okay, ngayon pag nagkaroon ng pressure dyan, sir, that's the time na nakakapag-form tayo ng pouch. Okay, nagkakaroon tayo ng pouch formation. And yung pouch formation na po yun, class, that is already your diverticulosis. Okay, diverticula, kapag iisa, pag madaming outpouch yan or madaming formation ng pouch, we call them as your diverticulosis. Okay, tinatawag natin siyang diverticulosis. Okay, so that is already the pathophysiology of the formation of your diverticulosis na tinatawag natin. Okay, ulitin natin, pag sinabi nating diverticulosis, that is just the outpouching of your intestinal mucosa. Ibig sabihin, nagkakaroon ng sac-like herniation dun mismo sa lining ng ating GI tract. And they tend to be asymptomatic. Ibig sabihin, hindi tayo nakakaramdam ng any symptoms unless we're going to have our diagnostic test like your colonoscopy. Okay, and the most common site therefore, okay, of your diverticulosis, although it can occur anywhere in our GI tract, ang pinaka-common site pa rin ng ating diverticulosis is your sigmoid colon, and ang number one cause niyan is your tubol. Bakit tayo nagkakaroon ng tubol? It's because you have chronic constipation. Okay? You have low fiber diet intake. You have decreased oral fluid intake. And of course, you have a sedentary lifestyle. Ang mangyayari dyan, kapag meron kang tubol, of course, nahihirapan tayong ilabas yung ating fecal matter. So, ang nangyayari dyan, nagkakaroon ng increase in your intraluminal pressure. Ibig sabihin nun, yung ating mucosal, okay, or yung mismong submucosal layer ng ating GI tract ay nagkakaroon ng herniation through your muscular wall. Therefore, nagkakaroon po tayo or nakakapag-form po tayo ng pouch na tinatawag. Okay, yun na po yung tinatawag natin na diverticula. Kapag iisa, okay, singular form, and then kapag marami naman pong na-form, tinatawag po natin siyang diverticulosis, I should say. Okay, so that is your diverticulosis natin. Ngayon, in here, of course, kailangan nating malaman kung ano po yung management ng ating diverticulosis or how could we prevent your diverticulosis. Okay, of course, mag-start tayo sa diet natin. Okay, we have to instruct our patient to what? To increase their diet or their fiber in their diet. Okay, they have to increase their fiber intake into their diet. And aside from that one, okay, you also have to instruct them to increase their fluid intake, okay, for at least 2 to 3 liter per day. Okay, kailangan nilang mag-increase ng fluid intake. And of course, kailangan din nilang, we have to be very particular this one. Okay, they also have to eliminate foods. Ano po yung mga yun, sir? Yung mga pagkain na merong buto or mga pagkain merong mani. Okay, bakit kaya, sir? Kasi kapag nagkaroon sila ng ingestion of this type of food, okay, and then kapag marami yan, since meron na tayong mga pouch in our GI tract, okay, pwede po kasing sumiksik or pwede po kasing mapunta yung mga ganitong klase ng pagkain dun sa mismong pouch na yun. And that will lead to diverticulitis kapag yan ay na-inflate. Okay? And of course, for the medications naman po, we're going to administer your antimicrobials or your antibiotic. Bakit? Because this will serve as what? As a prophylactic one. Okay, this will serve as a prophylaxis. So, bago pa man magkaroon ng diverticulosis, bago pa man ma-infect yung kanyang diverticulosis, okay, or mag-lead into diverticulitis, we can already give your antibiotics for prophylaxis. Okay, we also have here your bulk-forming laxative. Para saan po yan? Of course, sabi natin, ang pinaka-root cause kung bakit tayo nagkakaroon ng diverticulosis is your constipation. So, we can give your bulk-forming laxative to prevent your constipation. Okay, so that's it for our diverticulosis. So, let's proceed naman po with our diverticulitis. Ngayon, pag sinabi naman po nating diverticulitis, from the word itself, diverticula, and plus your itis, we are already pertaining to your what? To your inflammation of one or more diverticula. Na-inflamed na po yung ating tinatawag na diverticula natin. So, what are the causes, no? Ang pinaka-common cause, okay, kung bakit na-i-inflame po yung diverticula or yung mga diverticulosis natin, it is because of the what? Okay, accumulation of fecal matter. Okay, nagkakaroon ng accumulation of your fecal matter. Okay, or your fecal material natin. Okay, once kasi po na nagkaroon ng accumulation on your fecal material at your pouch, okay, or dun sa mismong diverticula natin, ang nangyayari po dyan, class, or any aside sa mga fecal matter natin, nagkakaroon din mga iba't ibang mga foreign bodies, di ba, like your, sinabi natin kanina, yung mga foods natin with nuts and your seeds. Okay, pag nagkaroon kasi ng foreign body at your pouch or at mismo sa mismong diverticula natin, natatrap po sila. Okay, nagkakaroon po ng trapping of your foreign body, okay, or of your foreign bodies at your diverticula. Okay, natatrap po sila. Therefore, pag natrap po yan, nagkakaroon po ng obstruction. Okay, nagkakaroon pa ng obstruction, and then pag na-obstruct po yan, okay, meron pa bang enough na oxygen or meron pa bang enough na tissue perfusion pupunta doon? Of course, wala na. Pag na-trap po yan, that will lead to possible inflammation. Okay, mai-inflame po yan. It's because yung ating katawan, yung immune system natin, okay, madedetect niya kasi yan pag merong foreign body dun mismo sa ating diverticula. Pag na-detect niya yan, your immune system will automatically release your antibodies that will lead to possible inflammation to counterpart that foreign body that is being trapped in your diverticula. Okay, and then pag na-inflame yan, and pag yan ay, that will also lead to infection. Okay, pag na-infect na po yan, nagkaroon na po ng abscesses, yan na po yung tinatawag natin na diverticulitis. Okay, yan na po yung tinatawag natin na diverticulitis natin. Okay, so pagdating naman sa etiology and incidence of this disorder, always remember no that your pinaka-root cause kung bakit tayo nagkakaroon ng diverticular disorders is your what? Nagkaroon ka ng chronic constipation. Okay, or aside from that one, we also have here your IBD. Anong ibig sabihin ng IBD? This is your inflammatory bowel disorders. Ano yung mga example ng IBD natin or inflammatory bowel disorders? We have your ulcerative colitis. And we also have your regional enteritis natin. Okay, and usually, pagdating naman sa incidents no, ng ating disorder na to, they are usually common in adult patients. Bakit, sir? Because tandaan natin no, that your diverticulitis, okay, mismo dun sa mismong prevalence ito, it also increases with age. Okay, the prevalence of this disorder also increases with your age. Therefore, common siya sa mga patient na adult. Like for example, yung mga patient natin na 65-year-old and above or beyond. Okay, so let's proceed with the symptoms sa pwedeng maramdaman ng patient natin. Okay, nagkakaroon po sila ng pain on the lower quadrant. Okay, bakit po sila nagkakaroon ng pain on the lower quadrant? It's because saan po ba nakalocate yung ating sigmoid colon? They are located at your lower quadrant natin. So what is the type of the pain? Or ano po yung characteristics ng pain na nararamdaman ng patient natin? Usually, they experiences crampy type of pain. Okay, and of course, pwede din sila magkaroon ng nausea and vomiting. Okay, as part of the defense mechanism of our body that protects us no kapag nagkakaroon ng invasion of your foreign bodies in our body. Okay, and of course, nagkakaroon din sila ng constipation and of course, fever. Okay, hindi lang po siya simpleng fever because if your patient is going to undergo laboratory test, nagkakaroon po ng increase at their WBC. Okay, so ang tawag po natin doon, that is your leukocytosis natin. Okay, that is your leukocytosis. Nagkakaroon sila ng fever with leukocytosis. And aside from that one, nagkakaroon din sila ng intermittent rectal bleeding. Bakit po sila nagkakaroon ng intermittent rectal bleeding? It's because yung mismong eroded areas, nagkakaroon kasi ng erosion no, dun sa mismong GI lining natin. Therefore, okay, meron po kasing mga arterial branches dyan. Okay, there are arterial branches that are adjacent, okay, to your eroded area kung saan ka nagkaroon ng diverticulosis. Therefore, kapag nagkaroon ng nagkaroon ng erosion, maaapektuhan po yung mga arteries natin. That will lead to bleeding. Okay, therefore, nasa lower GI tract po tayo. Ano po ang characteristics ng bleeding na meron kay patient? Bright red po ang lalabas sa kanila. Ibig sabihin doon ay nagkakaroon sila ng hematochezia. Okay, nagkakaroon po sila ng hematochezia. Okay, so pagdating naman po sa ating assessment and diagnostic findings, okay, sabi natin kanina, okay, your patient will undergo what? Okay, your patient will undergo colonoscopy. Bakit, sir? For us to have a direct, okay, visualization of your, of the extent ng damage sa mismong intestines natin. Again, this is also your confirmatory confirmatory test para ma-determine natin kung ano na po yung extent ng damage ng ating diverticulitis in our GI tract. Okay, and of course, your patient will also undergo laboratory test. Bakit? Okay, dapat kailangan niya mag-complete blood count. Like, bakit, sir? Of course, nagkakaroon siya ng bleeding. Therefore, kailangan natin tignan yan kung mababa na ba ang kanyang hemoglobin or yung mismong RBC niya. And of course, nagkakaroon siya ng leukocytosis. Okay, nagkakaroon ng increase in their WBC so that we could rule out kung si patient meron po ba siyang diverticulitis. And of course, aside from that one, your patient will also undergo CT scan and X-ray. Okay, so pagdating naman sa management natin, class, okay, dun tayo sa ating acute phase or painful episodes. Okay, so during the acute phase, no, or your painful episodes kung kailan masakit po yung ating diverticulitis. Okay, ang pinaka number one goal po natin for this one is to what? Is to rest the bowel of your patient. Okay, we have to rest the bowel of your patient. Bakit po, sir? Kasi nga, pag hindi mo ni-rest yung bowel ng patients natin, ang pwedeng mangyari dyan, okay, nagkakaroon ng increase in the intestinal motility of our patient. Therefore, that will lead to the possible complication na pwedeng mangyari kay patient. Ano yung pinaka-possible na number 1 na complication ng diverticulitis natin? Diverticulitis natin, magra-rupture po yung mga pouch na yan. And pag nag-rupture yan, magkakalat-lat ng abscesses and any foreign bodies at your outside your natin, nagkakaroon yan ng possible peritonitis. Okay, ang pinaka-complication po ng ating diverticulitis ay what? Peritonitis. Okay, so sabi natin ang pinaka-goal natin for this one as part of its management po ay what? To rest the bowel of your patient. By how, sir? Okay, we could instruct our patient to have complete bed rest. Okay, bakit ka naka-complete bed rest? Because kailangan nating reduce po yung mismong intestinal motility natin. We need to reduce the intestinal motility of our patient. Therefore, kailangan po niyang mag-complete bed rest. And aside from that one, kung kanina sa diverticulosis, high fiber diet. Dito sa diverticulitis, since you're going to rest the bowel of your patient, dapat ay naka-low fiber diet po yan to decrease the intestinal motility of our patient. And of course, we could actually rest our bowel by putting our patient in ating per orem status so that we could decrease the intestinal motility of our patient. Therefore, we could decrease the chance for your the chances of your diverticula to rupture. Para hindi po sila mag-rupture, para hindi po tayo magkaroon ng complication na peritonitis. Okay? So, pagdating naman po sa medication natin, class, okay, when it comes to the medications, ang kailangan lang naman nating tandaan dito is that, okay, since very painful po, okay, during the acute phase, masakit po yung ating diverticulitis. Therefore, we could administer your analgesics. Okay? And aside from that one, we could actually administer your what? Antibiotics. Okay? Because your antibiotics will help with the inflammation and with the infection. Okay? So nagiging prophylactic po siya. Okay? Nagiging prophylaxis po siya. And kapag nag-rupture man yan, at least, pwede po nating matreat yung mismo magiging effect ng infection of our patients. Okay? So, ang nagiging prophylactic and therapeutic po, yung antibiotics sa kanila as prescribed by your attending physician. And aside from that one, anticholinergics. Bakit po tayo magbibigay ng anticholinergics? It's because we need to, sabi natin kanina, rest the bowel of our patient. We need to decrease the intestinal motility of our patient. Kasi yan po ang ginagawa ng ating anticholinergics. Excuse me. Excuse me. Okay? So, what specific anticholinergics yung pwede natin ibigay? Meron po tayong tinatawag na profanilin. Okay? That is the anticholinergic that we could administer to your patients as prescribed by your physician with patients who have diverticulitis. Okay, so that's it for your diverticular disorders. We have your diverticulosis and we also have your diverticulitis.